In this video, we will learn about the drugs that are used in the heart failure, and in order to understand the mechanisms by which these drugs act, we need to have a little overview of heart failure. So, heart failure, it is a very extremely serious condition that is associated with a very high mortality rate, and the basic defect is that there is decreased in the cardiac output relative to the needs of the body, which means that the output by the heart is unable to meet the demands of the body, and as a result the patient will go into heart failure. The major manifestations of heart failure are fatigue and dyspnea. The patients who have heart failure, they have trouble breathing in, and they get tired very early. They are usually very lethargic, and the cause of heart failure is usually chronic hypertension or any valvular disease or cardiomyopathy. All these conditions, they are associated with the development of heart failure in the body. So when the heart failure occurs, or when in any patient, when the heart is unable to pump sufficient blood to the body, the body reacts in a compensatory mechanism, and the body is tries to compensate the failure of the heart by various mechanisms, and these mechanisms include activity of the baroreceptors by the kidneys and the heart. So first we'll discuss the heart. So what actually happens, that as we know that the cardiac output is low and it is not sufficient to maintain the demands of the body, that means there is an increased tension in the heart, and this increased tension, it results in the increase in the size of the cells of the heart, which are also called as myocytes. So as a result, there will be an increased size of the heart. This phenomena is known as hypertrophy or cardiomegaly, in which the size of the heart is increased, and this size is increased in order to compensate the decrease in the cardiac output. This mechanism is mediated by angiotensin, which is an enzyme, and mediated hormone that regulates the blood pressure by constricting the blood vessels and triggering potent sodium intake. So it is mediated by the sympathetic nervous system. So this is how the heart is trying to compensate with the increased demands of the body. Now, the second most important organ that acts in this context is the kidneys. Now, the kidneys will sense there is a decrease in the cardiac output, and as a response they will try to retain more fluid in the body. As a result, they will increase the preload towards the heart, and the cardiac output is really increased because of an increased fluid in the body. The third response is the baroreceptor response. The baroreceptors, they are present in the vessels, and they will send a signal to the brain. This brain will activate the sympathetic nervous system. As a response, there will be an increase in the rate of the heart, and there is an increase in the contractility of heart, and all the mechanisms that are carried out by the sympathetic nervous system, they will be activated. Now, as a result, the cardiac output will be increased. Now, these are the mechanisms, or these are the responses that are happening in the body in response to the failure heart. So initially they have a positive effect on the body, that they will increase the cardiac output, but in the long term they are not very beneficial for the body and the patient. Most of the symptoms that are experienced by the patients are due to these compensatory responses. Let's say that there is an increased fluid in retention in the body. So this increased fluid, it will go into the lungs, and it will go into the extra cellular spaces, and they will cause it will cause the pulmonary edema. It will cause the edema in the body, and the patients will experience the symptoms of dyspnea and fatigue. So initially the compensatory response, they are doing good to the body, but after some time these compensatory responses, they become very detrimental to the body. So we need drugs in order to actually decrease the compensatory responses. And when we decrease these responses, the patient symptoms actually improve. So now we'll move on to the major or to the basic topic, which is the drugs that are used in heart failure. There are five major classes of drugs that are used in the context of heart failure, which includes diuretics, ACE inhibitors, beta blockers, inotropes, and vasodilators. We will discuss all these drugs separately. And in order to give an overview, diuretics, these are the drugs that get rid of the body of excess fluid and salt, and this is how they reduce the preload of on the heart and reduces the work of the heart, and this is how they are used in the heart failure. Diuretics are usually used in chronic heart failure, whereas there is one class of diuretics, that is loop diuretics, which is also used in the acute heart failure. So we use in acute heart failure, we use the loop diuretics, whereas there are other diuretics that are used in the chronic heart failure, like thiazide diuretics, or there are a class of the drugs which are known as SGLT2 inhibitors. These are the diuretics that are used in the chronic heart failure. We have ACE inhibitors. These are the enzymes. These are the drugs that inhibits the enzymes angiotensin, and this angiotensin, which plays a major role in the cardiac remodeling, or which causes an increase in the cardiac size, and we inhibit this drug, and by this mechanism we increase the symptoms of the patient. And there have been various studies which proves the mortality benefit of ACE inhibitors. We have the third class, which is known as beta blockers. These are the drugs that blocks the beta receptors, and thereby they inhibits the sympathetic nervous system, or thereby they reduce the workload on the heart. There are drugs which are known as inotropes, and these inotropes, they're basically used in the acute heart failure, in which the cardiac output is so low that it does not maintain, or it does not maintain the perfusion of the organs, of the vital organs, that are brain or kidneys. So these inotropes, they are used in the setting of acute heart failure. These are basically used to increase the rate and increase the contractility. So it's bizarre that we use the drugs which decreases the rate and contractility, and here are drugs which increase the rate and contractility. So both these drugs, they defy the actions of each other, but we use the beta blockers in the chronic heart failure, in which the blood pressure is not very low, and in the acute heart failure, as the cardiac output is low, as well as the blood pressure is also, it's too low to maintain the perfusion of the brain and the kidneys. So in the setting of acute heart failure, we use inotropes, whereas when in the setting of the chronic heart failure, in which the blood pressure is stabilized, we can use the beta blockers. And these beta blockers, they have a proved mortality benefit in the setting of heart failure. The last class of drugs is the vasodilators. These are the drugs, as the name indicates, they dilates the vessels, and this is how they will decrease the preload and the afterload, which means that they will offload the heart, they will reduce the activity of the heart, and they will reduce the effect that is needed. So this was the overview of the drugs that are used in the heart failure. Now we'll discuss all these drugs individually. The first class that is needed to be discussed are cardiac glycosides. These are the drugs. These were the drugs that were primarily used in the treatment of heart failure, but now they're no longer first line therapy. These are the drugs that are derived from a plant which is known as digitalis. It is also known as purple foxglove. So here is a picture of this drug. the drugs digoxin that is derived from this plant digitalis, and this drug, it has been, it has been used for a very, very long time in the management of heart failure, and nowadays we use in the treatment of heart failure, as well as it has also some other applications. As far as the chemistry is concerned, digoxin has a steroid nucleus and a lactone ring along with that. So here is a picture of this. Not need to remember the formula, but we need to know the chemistry of the drug. So when we attach the glucose moiety with this structure, it becomes a glycoside. So these are known as cardiac glycosides because these are the glucose containing compounds which have an effect on the heart. Now, the pharmacokinetics of digoxin, it has a very high bioavailability, that when you give the drug by mouth, it has a 60 to 75% of bioavailability, which means that if we give the drug and we consider that we have given like 100, so 60 to 75% will go into the bloodstream. The half-life of drug is very long. It has a half-life of around 36 to 40 hours, which means that it has a very long half-life. The metabolism is hepatic, and we need to adjust the doses if the patient has hepatic impairment, and the excretion is by kidneys, which means that we need to monitor the drug in the patients which have any kidney function problem. Now, the mechanism by which digoxin acts, that it inhibits a pump in the cell wall. So now we have a myocyte. Now we know that the heart, it's made of the cells of the heart. They are known as myocytes. And if we take one myocyte out of the heart and the cell membrane of one myocyte into a bigger picture, we'll know that the membrane, it has a pump which is known as sodium potassium ATPase. The digoxin, it works on this pump. Digoxin actually inhibits the sodium potassium ATPase pump, and as a result, the concentration of sodium inside it increases. There is an increase in the intracellular sodium. Now, this intracellular sodium will in turn causes an increase in the concentration of calcium. This calcium, it will go into the sarcoplasmic reticulum, where it is released for the in the vicinity of actin and myosin, and increase the contractility. So let's recall. This is how we increase the contractility of the heart by digoxin. Let's recall the digoxin. It will act on the sodium potassium ATPase pump, which is present on the cell membrane of the myocytes. It will cause an increase in the intracellular sodium. This intracellular sodium will in turn causes an increase in the intracellular calcium, and this intracellular calcium will be sequestered in the sarcoplasmic reticulum, which is released in the actin and myosin vicinity, which causes an increase in the contractility, which is a desired effect of the drug digoxin. So as a result, we will have an increase in the contractility of the heart. We will have an increase in the cardiac output, which causes an increase in the renal perfusion. So all these mechanisms, they are carried out by the increase in contractility of the heart, because by increasing the contractility, we are actually increasing the cardiac output, and when the cardiac output is increased, there will be more blood that is reaching the kidneys. There's also a decrease in the sympathetic outflow, and this decrease in the sympathetic outflow, it will decrease the heart rate, it will decrease the preload, it will decrease the afterload, and this is how it is reducing the workload of the heart. It increases the refractory period, it increases the contractility, but the heart rate is decreased. So this is why digoxin is also used in the treatment of atrial fibrillation, which is an arrhythmia of the heart. So the clinical uses of the digoxin, number one is the congestive heart failure, which we have already learned about, that it increases the contractility of the heart, it decreases the heart rate, it reduces the workload on the heart, and this is how it is used in the treatment of congestive heart failure, as it decreases the heart rate and it prolongs the refractory period of the heart. We use it in atrial fibrillation, which is a kind of arrhythmia. So if the patient has a low blood pressure and arrhythmia, we will use digoxin for the treatment of atrial fibrillation. Now, digoxin is a wonderful drug, but it has many serious interactions. And we need to all these interactions because they're very important and they could be life threatening to the patient. So we need to remember these interactions. So the first is with the drug quinidine, which is an antimalarial drug. It increases the levels of the digoxin to a life threatening level. So if a patient is having quinidine and digoxin together, we need to monitor the levels of digoxin in the body. Number second, and very important and very most commonly seen, is the electrolyte imbalance. If the patient has any electrolyte imbalance, which means if the patient has low potassium, or if the patient has low magnesium, or the patient has low calcium, all these conditions, they will increase the arrhythmogenicity of the digoxin, and the digoxin in this setting, the digoxin will be more arrhythmogenic. The patients which are having loop and diuretics, which is very common in the setting of heart failure, we need to remember that these diuretics, they causes a decrease in the level of potassium, and when the potassium is decreased, the toxicity of digoxin is increased. So if the patient is on any loop diuretic along with digoxin, we need to monitor the levels of digoxin in the body. The toxicity of digoxin is basically the direct extension of its therapeutic effect. The patients can suffer from arrhythmias, and we need to monitor the levels of digoxin in order to prevent any arrhythmia, because there is increased calcium accumulation in the body. There will be some GIT symptoms, which are nausea, vomiting, or diarrhea, which are very common with the use of digoxin. There are some CNS symptoms that are also associated with the use of digoxin, which includes confusion, hallucination, visual, and some endocrine aberrations are also seen with the use of digoxin. Severe intoxication of digoxin can lead to cardiac depression. So what happens now? What if we see the patient who has toxicity with the digoxin? What do we do now? How do we correct the poisoning? In the first step is to replace the potassium, because when there is hypokalemia, there is an increased chance of toxicity of digitalis. So we need to omit the dose of digoxin and we need to replace the potassium. This is the first thing that we will do if there is poisoning by the digoxin. Second, if the patient has arrhythmias, or if the patient is suffering from ventricular tachycardia or ventricular fibrillation, we will give the drugs which are antiarrhythmic, such as lidocaine or phenytoin, or any beta blocker such as propranolol. Digoxin antibodies are also available in the market, which are known by the name Fab fragments or digibind. These are the antibodies that binds with the digoxin and neutralizes the effect of digoxin. They're very important in reversing or in correction of the poisoning. Now Now, the second class of drugs that are used in the treatment of heart failure are diuretics. These are the first line systolic. These are the first line drugs that are used in the systolic and diastolic failure. And what they do is that they get rid of the body from the extra fluids, and as a result, there is a decrease in the venous pressure, which is the pressure in the veins, because there is less volume in the body, and this is how they decreases the ventricular preload and reduces the work of the kidney. They are used in both chronic and acute heart failure, as already discussed. The In the acute heart failure, the loop diuretics are used, and these loop diuretics, they immediately offload the body, and this is how they are used in the treatment of acute heart failure. There are another class of the diuretics which is known as thiazide diuretics, and it contains the drugs hydrochlorothiazide and chlorthalidone. These are the drugs that are used in the mild chronic heart failure, and they reduces the mechanism is same in both the settings. There are some diuretics which are aldosterone antagonists. They are also used in the chronic heart failure, which includes the drug spironolactone and epinone. Both these drugs are used for long-term benefits in the setting of heart failure. There is also a class which is known as SGLT2 inhibitors. This is basically an enzyme that is present in the cell wall of the in the present in the cell membrane of the nephrons, and which inhibits the reabsorption of the sodium and glucose, and by this way the body gets rid of more water, as both of these ions, they're not reabsorbed into the nephron, and this is how it offloads the body from the excessive fluid and salt, and thus have a beneficial effect in the setting of the heart failure. The next class of drugs that is used in the treatment of heart failure is angiotensin antagonist. As we all know that angiotensin, it is a hormone that is used in the cardiac remodeling, and we do not want cardiac remodeling, as in the long run it has detrimental effects on the heart and it does not benefit the patients of the heart failure. So the angiotensin, it is also responsible for the salt and water retention in the body. So these are the drugs that inhibits the effect of the angiotensin, and this is how they prevent the cardiac remodeling, and they decreases the salt and water retention in the body, and by this mechanisms they will cause a decrease in the preload and reduce the work of the heart. They also, the decreased level of angiotensin levels in the body, they also causes a decrease in the sympathetic outflow, and the this is very beneficial in the setting of heart failure, as there will be reduced work of the heart, and as a result the patient will have improved symptoms of the heart failure. The next drugs are the beta 1 agonist, and these are the drugs that are used in the acute heart failure. Acute heart failure, there is a decrease in the blood pressure when the cardiac output is so low that the body does not maintain a perfusion of the vital organs. So this is how we maintain the blood pressure in the body. So the next class is beta blockers. These are the drugs that are used in the setting of chronic heart failure, and in this setting we want to reduce the sympathetic outflow, or which is basically a compensatory response of the body, but now it is very detrimental to the body. So we want to reduce the work of the heart, so we will give the beta blockers at this stage when the heart failure is chronic and the blood pressure is stable enough to tolerate the beta blockers. So we use the three drugs that are metoprolol, bisoprolol, and carvedilol, they have shown in the studies to slow the progression of chronic heart failure. There is the drug nebivolol, which is also a vasodilator. The unique thing about nebivolol is that it dilates the blood vessels. It is an investigational drug in the setting of heart failure. So beta blockers, they are the first line drugs that are used in the management of chronic heart failure. The other class of drugs is the phosphodiesterase inhibitors, and these are the drugs that increases an enzyme, as the name indicates, which is phosphodiesterase. Now, when this enzyme is decreased in the cells, there is an increased concentration of CAMP, which is a molecule that causes an increase in the contractility. So it has a positive inotropic effect, which means that it will increase the contractility of the heart. So when do we need an increase in the contractility? When there is an acute heart failure. So in the setting of acute heart failure, we use phosphodiesterase inhibitors. The example of this class is milrinone. It is a very widely used inotrop that is used in the setting of heart failure. There is another drug, theophylline, which is a phosphodiesterase inhibitor, and it was used in the past for the treatment of acute heart failure, but now it is no longer used. And the mechanism is same, that it will increase the concentration of CMP. The increase of CMP causes an increase in the concentration of intracellular calcium, and as a result we see a positive inotropic effect. It can also cause arrhythmia as a toxic effect, but in the setting of acute heart failure, these drugs are used to increase the blood pressure in the body and to increase the cardiac output. Now we have vasodilators, and as the name indicates, these are the drugs that dilate or the vessels, and this is how they will decrease the preload and the afterload. The drugs in this category are nitroglycerin. These are the drugs that improves the symptoms of the heart failure by decreasing the preload, the offloads the heart, decreases the work of the heart, and this is how they are useful in improving the symptoms of the heart failure. There are some enzymes that are released from the cardiac atria and other tissues, and which are known as ANP and BNP, which are known as atrial natriuretic peptide or the brain natriuretic peptide. So there are some drugs which inhibits the enzymes that are responsible for the destruction of both these molecules, and these molecules, they have a vasodilatory effect. So a drug that is available in the market that inhibits this enzyme is called as sacubitril. This is also used in the treatment of chronic heart failure. The next drugs are Diuretics, sacubitril, which we have already discussed, and then there are some oral vasodilators that are used in the setting of heart failure. Diuretide, it is a commercial version of BNP. BNP is brain natriuretic peptide. It is a molecule that causes vasodilation, and as a result, they decreases the afterload and the preload. The IV infusion of this drug is used in the treatment of acute heart failure, and it has a natriuretic effect. That means it will causes the excretion of sodium from the body. It can also cause renal toxicity. We need to monitor the renal functions of the patient who is receiving this drug. The second drug is sacubitril, which is an enzyme inhibitor. This enzyme is called as neprilysin. This neprilysin basically breaks down the ANP and BNP. Both these are responsible for the vasodilation. So we inhibit this enzyme by this drug, and there is an increased concentration of ANP and BNP, increased vasodilation. And we need vasodilation because it will reduce the preload and afterload of the heart, and thereby they have an beneficial effect in the setting of heart failure. There are also some oral vasodilators available which acts by the same mechanisms, and these include hydralazine, isosorbide dinitrate, and it reduces mortality in the patients with heart failure. So this was all about the drugs that are used for the treatment of heart failure.